everyone, my name is Priyanka and today we will study solid dosage form tablets. What are tablets? According to USP, tablets are solid dosage forms containing medicinal substances with or without suitable diluents. According to IP, pharmaceutical tablets are flat or prepared by compressing without suitable diluents. They may be classed according to manufacture as compressed tablets, molded tablets. Mainly tablets are prepared by compression method and a very little number are prepared by molding method. What are properties of tablets? Now tablets must be sufficiently strong and resistant to shock and abrasion. Why? To withstand handling during manufacturing, packing, shipping and use. And hardness and friability tests are used to measure this property. Next is uniformity. Uniformity in weight. Tablet must be uniform in weight and in drug content also. And this property is measured by weight variation and content uniformity test. Next is drug content of the tablet must be bioavailable. This property is measured by dissolution test. Tablets must be elegant in appearance and must have characteristic shape, color, other markings necessary to identify the product. Other markings like engraving, embossing, print like. Tablets must retain all these functional attributes which include drug stability and efficacy. This is also important. What are the advantages of tablets? From the patient point of view, they are easy to carry, easy to swallow, attractive in appearance. Unpleasant taste can be masked by sugar coating. They do not require any measurement of dose. The strip or blister packing has further facilitated the process of taking the dose by the patient. Moreover, the blister and this strip pack also provides a sealed covering which protect tablet from atmospheric conditions like air, moisture, light, etc. Some of the tablets are divided into half and quarter by drawing line during manufacturing to facilitate breakage whenever a fractional dose is required. We can take half also, 1/4 also. What are the advantages of tablets from manufacturer point of view? An accurate amount of medicament, even if very small, it can be incorporated into tablets. Tablets provide prolonged stability to medicament. They have best combined properties of chemical, mechanical and microbiological stability of all the oral dosage forms. The incompatibilities of medicaments and their deterioration due to environmental factors are less in tablet forms. Since they are generally produced on large scale, therefore, their cost of production is relatively low, hence they are economical. They are in general easiest and cheapest to package and ship among all oral dosage forms. Some specialized tablets like enteric coated tablets, sustained release tablets, they can be prepared by modifying the release profile of drug. Product identification is potentially the simplest and cheapest, requiring no additional processing steps when employing an embossed or monogrammed punch phase. Engraving and embossing can be done during the manufacturing only by employing the embossed or monogrammed punch phases. Now, what are the disadvantages of tablets? Some drugs resist compression into dense compacts owing to their amorphous nature or flocculent or low density character. Drugs with poor wetting, slow dissolution properties, intermediate to large dosage, optimum absorption high in gastrointestinal tract, or any combination of these features may be difficult or impossible to formulate and manufacture as tablets that will still provide adequate or full drug bioavailability. Bitter drugs, drugs with objectionable odor, or drugs that are sensitive to oxygen or atmospheric moisture may require special process like encapsulation or a special type of coating which may increase the stability of finished tablets. So this will increase a step. If drugs are bitter or objectionable odor or they're sensitive to oxygen, you require encapsulation or a special type of coatings. Now, what are types of tablets? Tablets can be classified as tablets ingested orally, tablets used in oral cavities, tablets administered by other routes, or tablets used to prepare solutions. Tablets ingested orally are further subdivided into compressed tablets, multiple compressed tablets, controlled release tablets, sugar coated tablets, film coated tablets and chewable tablets. Tablets used in oral cavities can be subdivided into buccal tablets, sublingual tablets, lozenges, and dental cones. Tablets administered by other routes can be subdivided into implantation tablets and vaginal tablets. Tablets used to prepare solutions can be subdivided into effervescent tablets, hypodermic tablets, dispensing tablets, or tablets triturate. Now, what are the types of tablets? We'll study in detail. Tablets are classified according to their route of administration or function. The following are the four main classification groups. First one is tablets ingested orally. And in them first is compressed tablets. Compressed tablets are made by either direct compression, wet granulation, or dry granulation in their simplest form containing no special coating. They are the simplest form of tablets. They are made from powdered, crystalline, or granular materials alone or in combination with the excipients like binders, disintegrants, controlled release polymers, lubricants, diluents, and in many cases colorants. They may be used for local action in GIT or systemic action also. The vast majority of tablets commercialized today are compressed tablets only, either in uncoated or in coated states. Examples are like Disprin and tablets like Crocin. Next is multiple compressed tablets. Multiple compressed tablets are made by more than one compression cycle. This process is best used when separation of active ingredients is needed for stability purpose, or if the mixing process is inadequate to guarantee uniform distribution of two or more active ingredients. Active ingredients are not mixed properly, or to produce repeat action or prolonged action products. They can be subclassified as layered tablets. What are layered tablets? Layered tablets are tablets prepared by compressing additional tablet granulation on a previously compressed tablets. Previously compressed tablets इसके ऊपर से फिर से granulation डाला है और फिर से इसे compress किया, उसमें compression होगा. This operation is repeated a number of times to produce a multiple or a multi-layered tablet. You can see in the figure. Special tablet press are required to make layered tablets such as Versa press. Now we'll see some of the examples of the layered tablets like mixture containing phenylephedrine hydrochloride and ascorbic acid with paracetamol. This paracetamol and phenylephedrine hydrochloride will form the one layer. Paracetamol and ascorbic acid will form the other layer. So these two will be separated. Next example is analgesic antipyretic decongestant containing aspirin and phenylpropanolamine. A thin layer of placebo is placed between the two to negate the chemical incompatibility of these active ingredients. Now, compression coated tablets. Compression coated tablets are tablets prepared by feeding a previously compressed tablet into a special tablet machine and then compressing another layer around this preformed tablets. With this method, incompatible ingredients may be kept in separate layers. It has all the advantage of compressed tablets such as slitting, monochroming, speed of disintegration, etc., while retaining the attributes of sugar-coated tablets in masking the taste of medication in the internal layers. Multiple compressed tablets readily lend themselves to repeat action product, mainly used as a repeat action product where first layer or the outer layer of the compression coated tablet, one layer of the layer tablet or outer layer of the compression coated tablet, it will provide the initial dose and rapidly disintegrating in the stomach. Outer layer or inner tablet, it may also be formulated with the components that are insoluble in the gastric media but will release the drug in intestinal environment. So they can also be used as a repeat action product where outer layer will provide first initial dose and the inner core will provide second dose, and they may also be coated with the outer layer or the inner tablet of the compression coated tablet may also be coated with the enteric coating polymers that will release the drug in the intestine, not in the stomach. Inlay tablets. Inlay tablet, also referred to as dot or bull-eye tablet, is a variation of compressed tablet with partially surrounded core. Inlay tablet are prepared by feeding previously compressed tablet into a pre-filled dye cavity of a Stokes, Corton or Killan machine, and then some compression, coating material is added. When compressed, some of the coating material is displaced to form the sides. What is the advantage? Over compression coated tablets such as less coating material is required, core is visible. So colorless tablets can be easily detected, and reduction in the coating form. Reduction in the coating forms a thin layer tablet and thus freedom from capping of top coating. Used in sustained release preparations to reduce the size and weight of the tablet. What are the disadvantages? Poor centration is the main disadvantage in inlay tablets, and also color reaction due to incompatibility between the core and the coating are evident. Example is 25 mg of hydrochlorothiazide in bolide tablet, where 600 mg of potassium chloride is in the outside portion. Next is controlled release tablets. Compressed tablets can be formulated to release the drug slowly over a prolonged period of time. Hence, these dosage forms have been referred to as prolonged release or sustained release dosage forms as well. These tablets as well as their capsule version can be categorized into three types. First is enteric coated tablets. These are tablets that are coated with a polymer that does not dissolve under acidic conditions. Polymer that does not dissolve in stomach where pH is up to 4. But this polymer dissolve under more alkaline conditions of the small intestine where pH ranges from 7 to 8. Plus esterase enzyme in the intestine, it breaks down the ester linkage of the polymer chain. Hence these polymer are dissolved in the intestine and not dissolved in the stomach. Enteric polymers primarily inhibit the dissolution of therapeutic agent within the stomach, offering protection against possible drug degradation, irritation of the gastric mucosa, and when bypass of the stomach enhances the drug absorption. What are the uses of enteric coated tablets? Drugs such as erythromycin, they are degraded in the stomach, so it can be enteric coated. Drugs like non-steroidal anti-inflammatory drugs, irritation in also be enteric coated tablets, and absorption of drug is more in the small intestine, or when bypass of the stomach enhances the drug absorption. These type of tablets can also be given as enteric coated tablets. What are the polymers that are used in enteric coating? These are cellulose acetate phthalate cap, polyvinyl acetate phthalate, hydroxypropyl methyl cellulose phthalate, methacrylic acid copolymer, which is also called eudragit, cellulose acetate butyrate, hydroxypropyl methyl cellulose succinate. So these are the polymers which are used in enteric coating. Next, after enteric coated tablet is controlled release tablets. The term controlled release is more specific term and may be defined as delivery of drug at a predetermined rate for a defined period of time, or those that release the drug in a relatively steady or in a controlled manner. So it has a predetermined rate of release of drug. These are controlled release tablets. Enteric coated tablets are tablets which do not release drug in the stomach. Okay, next is the repeat action tablets. What are repeat action tablets? Those that combine combination of mechanisms to release pulse of drug. These are repeat action tablets. Core of the tablet is usually coated with shellac or enteric polymer so that drug do not release in stomach. So this is the first dose, and the second dose of the drug is added in the coating, in the sugar coating, either in the solution in syrup or as a part of dusting powder added for rapid coat build-up. First dose in the coating, second dose is in the core, so it will provide a repeat action. So these are repeat action tablets. This is the figure where tablet core, rapid release function, and it has enteric coating, acid resistant function. Coating is of hydroxypropyl methyl cellulose. When the coating will release, drug will release. Next is sugar coated tablets. Sugar coated tablets are compressed tablets surrounded by a sugar coating. Such coatings may be colored or are beneficial in covering up drug substances possessing objectionable taste or odor, and in protecting material sensitive to oxidation. They are also used to separate incompatible ingredients in core and coating. The process includes seal coating, waterproofing, subcoating, syrup coating for smoothing and coloring, and polishing. So what are the steps? Seal coating, subcoating, syrup coating, and then polishing. Sugar coated tablet may be 50% larger and heavier than the usual tablet. So coating makes these tablets 50% larger and heavier than the simple compressed tablets. Next is film coated tablets. Compressed tablets having a film coating of some polymer substance such as hydroxypropyl cellulose, hydroxypropyl methyl cellulose and ethyl cellulose. These polymers are used for the film coating. The film coating protects the medicament from atmospheric effects. Film coated tablets are generally tasteless, having little increase in the tablet weight. This is the advantage over sugar coating tablet, that there is very little increase in the tablet weight and have less elegance than that of sugar coated tablets. Sugar coated tablets are more elegant but increase in weight is more. These are less elegant but very little increase in weight of the tablet, so it is the advantage. Next is chewable tablets. These tablets are required to be broken and chewed in between the teeth before ingestion. Simply these are meant to be chewed in the mouth. These tablets are given to the children who have difficulty in swallowing or to the adults who dislike swallowing. A number of antacid tablets and multivitamin tablets are prepared as chewable tablets. For the preparation of chewable tablets, mannitol is used as a sweetening base. Mannitol has negative heat of solution which results in cooling effect and also has sweetening action also. Since mannitol is expensive, other substances like sorbitol, lactose, chocolate powder, dextrose and glycerin can be substituted in place of mannitol. These tablets do not require any disintegrating agent to be present in the formulation. Okay. These tablets should have very acceptable taste and flavor. Antacid tablets, vitamin C chewable tablets, these are given as chewable tablets. You can see here. Next category is tablet used in oral cavities. First is buccal tablets. These are the tablets that are administered in buccal pouch, the space between the lip and gum in the mouth. They may dissolve or erode slowly. It is placed near the opening of the parotid duct to provide medium to dissolve the tablet. These tablets should not disintegrate rapidly in the mouth, but rather they dissolve slowly for the 15 to 30 minutes for absorption from the oral mucosa. What is the advantage? First pass metabolism is bypassed and it gives a rapid systemic action. Progesterone tablets are administered as buccal tablets. Next is sublingual tablets. Example of these tablets are nitroglycerin, isoproterenol, hydrochloride or erythritol tetranitrate. These are placed under the tongue. Sublingual tablets, they dissolve rapidly and the drug substances are absorbed readily by this form of administration. You can see in the figure. Next is lozenges and troches. These tablets are designed to exert a local effect in the mouth or throat. They also do not disintegrate in the mouth, but they dissolve slowly in mouth for 30 minutes. These tablets are commonly used to treat sore throat, to control coughing and common cold. Okay, they may contain local anesthetic, antiseptics, antibacterial agents, astringents or antitussives. Lozenges may be made by compression but are usually prepared by fusion or by candy molding process. And troches are prepared by compression method. Okay, generally they contain a sweetening agent, flavoring agent, peppermint, clove oil, like these flavoring agents like peppermint and clove oil, and a substance which provide a cooling effect like mentha. An example of lozenges is Vicks lozenges. Okay, dental cones. These tablets are designed to be loosely packed in the empty socket, remaining following a tooth extraction. Main purpose behind the use of this tablet is either to prevent multiplication of bacteria in the socket or by employing a slow releasing antibacterial compound or to reduce bleeding by an astringent or coagulant containing tablet. It's formulated to dissolve or erode slowly in the presence of small volume of serum or fluid over 20 to 40 minute period. Mainly vehicle used in these tablets are sodium bicarbonate, sodium chloride and amino acids. Now tablet is administered by other routes, implantation tablets. These tablets are inserted into subcutaneous tissue by surgical procedures where they are very slowly absorbed over a period of month or a year. A special injector with a hollow needle and plunger is used to administer rod-shaped tablets, and for the other shapes, surgery is required. The tablets may be pellet, cylindrical or rosette shape with diameter not more than 8 mm. Mainly these tablets are prepared for administration of hormones such as testosterone steroids for contraception. They usually contain rate controlling excipient in addition to the active ingredients. For example, Implanor tablets. Okay. Next is vaginal tablets. These tablets are meant to dissolve slowly in the vaginal cavity. These tablets are typically ovoid or pear-shaped for ease of insertion. These tablets are used to release steroids or antimicrobial agents. These tablets are often buffered to promote a pH favorable to the action of a specific antimicrobial agent. They contain easily soluble components like lactose or sodium bicarbonate. The liver this is the advantage, that the liver can be bypassed through this mode of drug delivery, thus preventing drug destruction. Most commonly used for the vaginal infections. Now, tablets used to prepare solutions. Effervescent tablets. In addition to drug substance, effervescent tablets contain sodium bicarbonate and an organic acid such as tartaric acid or citric acid. In the presence of water, these additives react and they liberate carbon dioxide that act as a disintegrator and produces effervescence. Due to liberation of CO2 gas, the dissolution of API in water as well as taste masking effect is enhanced. Binders such as cellulose, gum, gelatin and starch paste are not used in the effervescent tablets due to their slow solubility and high residual water content. Dry binders such as lactose, dextrose and mannitol are preferred. Now, packaging of effervescent tablets are done in two types, like hermetic type foil pouches or stack packed in cylindric tubes. Next is dispensing tablets. Dispensing tablets, also referred to as compounding tablets, are tablets supplied primarily as a convenience for extemporaneous compounding. These tablets contain large amount of highly potent API and thus are used by the pharmacist to compound prescriptions that can be incorporated readily into powders and liquids, thus circumventing the necessity to weigh small quantity of these potent drug substances. Dispensing tablets are no longer in use and has a dangerous potential of being inadvertently dispensed as such to the patients. Example of dispensing tablets are silver potentiate, bichloride of mercury, merbromine and quaternary ammonium compounds. Hypodermic tablets. These tablets contain one or more readily water-soluble ingredients that are intended to be added in water for injection or sterile water to form a clear solution which is to be injected parenterally. It can be used for medicaments whose stability in water is poor. Next is tablet triturates. These are powders molded into tablets. They are flat, circular discs, usually contain a potent substance mixed with lactose and sucrose, dextrose or other suitable diluent. Since they are intended to disintegrate very quickly in contact with the moisture, water-insoluble adjuvants are avoided. Tablet triturates are usually made from moist material, using a triturate mold that gives them shape of cut sections of cylinder. You can see in the figure. Such tablets must be completely and rapidly soluble. Okay, thank you for your time and attention. If you really like the content of the video, please like and subscribe Pharma Guide.